announcement of an unprecedented plan to delay all non-urgent operations through January. So we've been asking, what is the solution to all of this? Was there another way around it, I wonder? Stephen Dorrell is a former Conservative Health Secretary, current chair of the NHS Confederation, which represents health trusts around England. Good morning, Stephen Dorrell.
Good morning.
So anyone who turns up to A&E, short of a life-threatening or genuine emergency situation, are they wrong to do so?
No, I don't think that's a fair way of putting it. I think the A&E department is there to meet accident and emergency need. What it shouldn't be there for is to meet more broad social needs that can be better met from the point of view of the individual citizen by other public services. And I think the key thing when thinking about pressures on the A&E department is to think of it as the canary in the mine, as the sign about the health of the broad range of public services, whether it's GP services, social care, social housing. When those are under stress, what tends to happen is that people they present at accident emergency departments with conditions that should, in a better structured range of public services, be met outside the hospital, within their home.
You say better structured, plenty of people say better funded, and we had NHS worker after NHS worker on this programme yesterday saying this is a funding issue. Fundamentally, this health service has not been given the cash that it needs. And in some cases, people believe it is being deliberately run down by this government.
Well, I don't believe that it's being deliberately run down by the government, and I absolutely accept, and indeed have argued many times, that we need to look at funding questions alongside structure questions. I don't think there's a choice about this. We need to look both at the total amount of money spent and at how it is spent on the range of public services. The mistake is to imagine that we can starve other public services and it'll all be all right because we fund the NHS. What we have to do is to look at public services as a whole.
Do you think the government's made a mistake, though, in terms of its funding commitments to the NHS? Has it underestimated the scale of the problem here?
Well, I think that, as ministers have said, first of all, that they've apologised for the cancelled operations, and they've said that this is an unusually well-prepared set of arrangements for the normal winter pressures, all of which I think is true. But what they haven't done is listen to those who've made the case that if we're going to meet the demands of a rising elderly population, we have the opportunity to lead longer, healthier lives. But we can only do that if the full range of public services are funded to allow that to happen.
Yeah, I just go back to the idea that this was a well-prepared-for period of pressure, because we had someone text the programme this morning saying their father-in-law had turned up to have a hip replacement done yesterday and was at the point where the surgeon had made the marks on his leg when the surgeon was pulled and he was told he'd have to go home and wait, and it couldn't happen at all this month. Now, that's really traumatic for any individual to go through.
I completely agree, and should never happen. That, of course, in fairness to NHS England, is precisely what they're trying to avoid by announcing in advance that those operations that can be deferred from a clinical point of view for a week or two will be deferred in order to ensure precisely that kind of thing doesn't happen.
OK. So aside from putting perhaps more funding in place, structurally, what needs to change in your view? And that's a much more long-term plan.
It is a more long-term plan. It involves thinking about about social care in particular, but the broader range of locally provided services in the round. And that is, of course, what government and NHS England and local government have been trying to do over the last few months and years.
Well, it's what people have been calling for years, and yet it still hasn't happened.
Well, it's absolutely true that many of us have been calling for it. It's an urgent requirement, because one of the things that I think we should stand back and think about is that we talk about the pressures on the health service and the burden of health spending and public service spending. Actually, surely it's good news that modern services, modern clinical and other services, should allow us to lead longer not only longer, but also healthier and more enjoyable lives. But we can only do that if the range of services that make that possible are thought through properly and properly funded. And those are the questions that we in the NHS Confederation have been arguing should be thought about on a longer term, cross-party basis, rather than as a kind of knee-jerk response to short-term headlines about pressures in particular parts of the system and in particular in the A&E department.
Thank you, Stephen Dorrell, former Conservative Health Secretary, current chair of the NHS Confederation. This is what the government's saying about all this. We know the NHS is extremely busy, as it is always at this time of year, but hard-working staff are taking the necessary steps to make sure patients continue to get seen as quickly as possible. Our NHS was recently ranked as the best and safest healthcare system in the world, and the government is supporting it this winter with an additional £437 million, as well as £1 billion extra social care funding this year.